Hello and welcome to our webinar, Ask the Vet with Dr. Tom Tully. Welcome, Dr. Tully.
Well, how you doing, Laura? Yeah,
I am good.
Summertime. It's summertime. How about
It
that?
is. Well,
Yeah.
officially summer hits June 20th. So we've got like, what, 2 more days of spring, I guess.
Yeah, but I hear it's fairly summer-like in the West, so in the US, so it's fairly hot. So
very true.
and we have hurricanes already or tropical storms in the Gulf. So, that's
All sorts
usually,
of weather, right?
Yeah. Mm-hmm.
Oh my goodness. Well, let's see here. Hey, I was going to ask you, we're going to let people log on a little bit here. Just was reading an article this week about, have you ever heard about anting in parrots? I'm not parrots, in birds, where they, like wild birds, like crows and other birds, they'll go outside and they'll, if you see them like fluffed on the ground with their feathers out, they'll let ants crawl over their body to like take bacteria off of them. I thought it was fascinating. I was watching a video of that.
Yeah, I have not, I haven't heard that. And we have what they call fire ants down in.
Oh no, not fire ants. We're talking like black ants.
Good ants.
We got another ants.
or wingless wasps, as they are, and little bitty things, but they do pack a punch. So
yeah, it sounded like they're doing like their own spa day, with these non-biting, non-fire ants.
Yeah, not stinging ants. Well, that's good. That's good. No, I guess I haven't heard that, but I'm not surprised because that is a very good thing that the ants will do, and they you kind of wonder which was the first bird that allowed ants to get on them to do this.
Yeah, and the other ones were like, hey, that looks like something that's
So,
but those feathers are so tightly packed that when you get down to the skin, I'm sure they've got some stuff that they want removed, so like on their skin.
Spa day. I do agree with that.
That's funny. Oh, I just saw someone just said that they saw a crowd doing that posture yesterday and was wondering what they were doing. Yeah, look up anting, A-N-T, like ant with an I-N-G at the end, and you might see anyways. I thought that was fascinating.
Yeah, well, yeah.
So I think like usual, we're gonna probably have a good deal of questions to go through for today. So I think
it's never a dull moment, and we always have great questions. So looking forward to that, and we've had always a number of interesting cases with our wildlife and our companion avian species. So it's always an interesting day here at LSU, that's for sure.
That's right. And now we got some interesting questions coming your way. Let's see. So, just to remind everybody, I'm sure everyone knows by now if you've been a frequent viewer, but if you do have a question for Dr. Tully, to use the Q&A button feature, not the chat feature. So there we go. And right out the door, I've got a question for you from Jane, who has a 3-year-old budgie who is a chronic egg layer. And she's tried limiting daylight hours, cutting back on her food, dummy eggs, restraining rearranging the cage, and the Lupron shot. So she still has bouts of laying, the Lupron.
Oh, okay. Mm-hmm.
Sorry. Has bouts of laying still. So recently hospitalized for 6 days, minor prolapse, and the bird is not eating. Barium X-ray reveal enlarged liver and enlarged ventriculus, but no definitive cause for that was identified. So if she were to be permanently removed from the company of all other birds, do you think that she would stop the egg laying cycle? And then could the enlarged liver and ventriculus have anything to do with the constant egg laying cycles?
First of all, I don't think that the enlarged liver or the ventriculus, proventriculus, has anything to do with the egg laying. If she was removed from all other birds, that may really change in just environment may stop her from egg laying for a period of time. It may not. It's The bird is obviously getting good nutrition. It appears that Jane, you're taking very good care of the little bird, providing adequate nutrition for it to lay this many eggs, and an environment that the bird is comfortable in, um, having the ability to lay these eggs. But you know, nothing that and also that it appears that you having excellent care by your veterinarian with this bird. But the bird is reproductively active and efficient at laying these eggs, as you well know. And you've done just about everything that you can to try to reduce the egg laying of this bird. Unfortunately, this side of removing the oviduct, which doesn't necessarily guarantee that the bird will stop ovulating. It's going to be, as you can imagine, removal of the oviduct, or you know, is going to be major surgery for a bird this size. That's 30 grams, and very risky. And so with that, it's not something that I would recommend on a small budgie. And surely you're not going to remove the ovary on a bird this size because of the vessels that are around that ovary. So with that in mind, I think you've done everything that you can, and unfortunately this little bird is just laying eggs. And you know, you've tried the Lupron. I don't know if you've tried the injections or the implant, but either way, it doesn't guarantee, again, that the bird would stop laying eggs, and you would have to continue to provide that Lupron. If it did, we have had some success in cockatiels with the implants, but in certain cockatiels, it lasts a little bit longer. In others, not so much, and then you're looking at about $200 an implant. So it's not cheap by any stretch of the imagination, with no guarantees. So the best thing that you can do at this point is, either removing eggs. That's always a question. Do you keep the eggs in there, or do you remove the eggs? And I think it's 6 half dozen. The other, as far as the eggs are concerned, you keep them in, the next thing you know, you have 50 in there, and some of them are going bad. And then you say, well, you remove the eggs, and that's where you have birds that you say, well, we want the double clutch, where you remove the eggs, incubate them, and have the birds go back in and lay. On some of these very chronic egg layers that just lay eggs all the time, removing the eggs or keeping them in isn't going to stop them from laying the eggs. Even if it's on the bottom of the cage, you don't have a nest box or anything like that. This is a common problem, so it's a great question. And as you can see, it's frustrating especially on small birds, what to do. I had a chronic egg laying cockatiel, and I did everything I could this side of surgery to stop it from laying eggs. And in the end, all I did was make sure that she had calcium supplementation through a cuttle bone or a mineral block, or both, and adequate nutrition. And she just laid eggs all her life. And then you say, well, there's the possibility of egg binding, there's a possibility of prolapse. Yes, those are consequences, but when you go through everything that you can do to stop the bird from egg laying and it doesn't work, that is unfortunately some of the adverse side effects that can come with it. Some of the birds just continue to lay eggs, and then they'll stop. But this is something that You've done everything, and all at this point you can do is to provide good nutrition and calcium supplementation and a good environment. And like I said again, you can remove it from the other birds. The change in environment may get the bird a little bit like, whoa, what happened? And then stop laying eggs for a period of time, maybe. But in all likelihood, she'll get used to it and say, ah, it wasn't too bad, and start laying again. And of course, these eggs, if she's with a male, they could be fertile, but you don't want them. And so, you know, it's something that, you know, removing them is not going to be, it's not likely that she's going to be sitting on those eggs and incubating those eggs if there's no nest box and just laying them on the bottom of the cage. And also if she's by herself, you know, and laying eggs, those are not fertile for sure. And like I said, leaving them in or taking them out, I would, as soon as that my bird would lay an egg, I'd take it out. I'd take it out. And, you know, I don't think it has anything to do keeping them in or taking them out is going to necessarily stop the bird from laying one way or the other. Just through my experience.
Dr. Tully, is there an age range where a bird might taper off on laying eggs? Like this is a 3-year-old budgie. Is it?
Yeah, well, that's a good question. That's a good question, Laura. You know, you know, I would say you would think that the older the bird would get within its average age range, and we've talked about average age ranges in birds, and so if you want to say that a budgie's average life expectancy is, say, 10 to 12 years, you would think that you know, this bird has a long way to go before reaching that. But with that said, even in birds that reach their age expectancy, say a 15-year-old cockatiel. Now, you know, we've had this past couple of weeks, we've had a cockatiel that's 25 and one 27 in here. And that's extremely rare, you know, and not that they're laying eggs, but there's many birds, and you're probably aware of some birds that are older that you would think they're real old, say, you know, a 30-year-old parrot that is laying eggs, you know. And so that's, you would, you know, again, the older the bird is in reaching toward its life expectancy, its age, say like in humans, 80 years old. Well, of course, it's different reproductively for humans, but when I'm saying life expectancy, I'm saying like an 80-year-old human, okay? And so with that, some of these birds can live a lot longer. Like I said, most cockatiels, I'd say the average life expectancy about 15, 16 years. But we've had 25, 27-year-olds, just like in humans, you get, we know people that live to 100. You know, a lady in France lived to 120. So we know they can go longer, but I would expect the older the bird gets, the less reproductively active they are, and the greater chance that they would reduce the egg laying.
Okay. And then we have a question from Jennifer. Do you believe in giving birds probiotics after antibiotics? People on Facebook keep telling her that the bird needs them, but her vet says that it's not a good idea. So Jennifer says, my bird has had antibiotics maybe 3 times in the last year, and most recently for a sinus infection. And then also her bird was doing an open beak with the wagging tongue and seemed to be breathing hard, but it was only 77 degrees in the house. So let's see here. So yeah, he seemed to be doing it as he was super comfy and kind of drifting off to sleep. And then he seems to stop as soon as they touch or move him. And 10 years ago, he did the same almost every day, and the vet couldn't find a cause. Is there any reason for concern if he's 100% healthy otherwise? He's eating, drinking, flying, bathing, etc. Everything is fine. He's a green cheek conure. So green cheek conure with some interesting habits here on antibiotics.
Yeah. Well, we'll get to the probiotics first, since that was kind of the first question. We did some research on probiotics. We did 2 research studies on Benebac, and Benebac is a probiotic supplementation that they advertise for birds, and we wanted to see if there was anything objective that we could determine through research that would be able to show the benefits of a probiotic supplementation. Because theoretically, as far as a small bird is concerned, if you give them probiotic, if you look at baby birds in the nest, their crops are always full. The parents don't say, well, I'm going to feed you when your crop goes down to nothing. If you always look in the nest box, those baby birds have full crops all the time. It's always full. And so that's something to consider. And of course, hand feeding and then is not the same as the parents. I think we all can, we'll go with that. Everybody can realize that. But it is something to consider, and something that with macaws, I'm a little bit different on my thoughts as far as hand feeding. But we get back to probiotics, and so when you're thinking about a parrot, in a sense, or birds, when they feed the young, what are they doing? They're inoculating that young basically with bacteria that is hopefully what we would consider beneficial bacteria that would help populate their GI tract and aid in the formation of a microbiome, so to speak, in the GI tract that would be conducive to good digestion and health of that GI tract. And so the parents are, every time they feed, they're inoculating these birds. And so theoretically, what you're looking at with, say, probiotic supplementation is for the probiotics to one, help with good bacteria, that you want beneficial bacteria in the GI tract. So you're helping repopulate, or you're repopulating the GI tract with beneficial bacteria. And with the beneficial bacteria, you're looking to try to improve the environment within the GI tract so that they will thrive within this GI tract along with the other beneficial bacteria, and not necessarily those that are bad or pathogenic. Then the other aspect of the bacteria, the beneficial bacteria, is to bind to the intestinal tract villi, the extensions of the intestinal tract that absorb all of the nutrients within the intestinal tract. So the good bacteria bind to these sites so that the bad bacteria don't. So it's almost a protective mechanism that the probiotics bacteria or the good beneficial bacteria do. So it's repopulation. It's providing and making the environment conducive for the growth of good bacteria, and also protection. So those are kind of the 3 factors that you're looking at to provide for when you do probiotic supplementation or transfaunation in certain species where even humans with Clostridial infections, where they will actually transfaunate humans, but also in other animals where when transfaunation is taking fecal material and actually going ahead and putting the bacteria from the fecal material in the GI tract. And so that's somewhat along the same lines. You're repopulating with good bacteria. So with probiotics, is it good? Should you do it? Well, what we found in our study is that it doesn't hurt. Okay, there's nothing that's problematic with this. Now, we did seem to have some more positive results. We did use cockatiels, young cockatiels, and to see what the growth was on these young cockatiels with and without the Benebac probiotic supplementation. And what we seem to find that the gel formulation seemed to be better than the powder formulation, but there was no adverse results as far as the supplementing it. So we didn't have any adverse effects. Now, is it good? One of the main, I guess, what you would say, detractors when somebody's saying, well, what good does it do? Because the argument is that you need species specific bacteria, meaning that it has to be from a macaw, it has to be from a green cheek conure, it has to be from a budgie, it has to be from a cockatiel. That has to be the exact microflora that you need for the best results from a probiotic supplementation. And that if you use a commercial formulation that is from, say, it's an avian species, it's a chicken, let's say it's chicken microflora, which would or should work the best in chickens, how well does it work at a green cheek conure? And so that's one of the big, I guess, arguments as far as, well, what good does it really do? And so with all of that said, I still think that it's not going to hurt the bird. And there is the possibility that it would be beneficial, but there's no guarantees either way. And I can see why somebody would say, there's just not enough evidence that formulation is going to be beneficial. But without anything else and the possibility that it would be useful, I am not against giving probiotic supplementation, and will recommend it in certain situations. Not every time. And it depends on which case it is and what the bird is doing and what it is in for, disease condition. There's a lot of factors involved in which I would recommend it. I don't recommend it every time I prescribe antibiotic therapy to the birds. But and when I when I recommend it, I recommend giving it on a daily basis. I don't recommend every 2 days, 3 days, what have you. And so, which is a little bit different than the instructions from that particular product. And I mentioned that during the study. I don't really, with a bird say inoculating the young every time it feeds, why would you want to give probiotic supplementation every 2 or 3 days? I don't quite understand that. But nonetheless, in the conditions that I think that would may be helpful, I do recommend that.
And before we get to the tongue wagging part of the question, the part 2, is three time the bird had antibiotics prescribed 3 times in the last year. Is there a limit on how often a bird should be on antibiotics?
No,
Or max or
no, there's no limit, and that's a good question, Laura. But every time a bird should be is prescribed antibiotics, there should be a reason for that, and what is the general I guess underlying reason, and also why is that particular antibiotic provided? Because as we've said before, with medication and particularly antibiotics, there's only one there's only one positive with an antibiotic that your drug that you are looking to achieve, and that is to treat and a bacteria, and that's the only positive. We're treating this bacteria. However, with all of the antibiotics, they have multiple and many side effects, adverse side effects. Not to say one of the most important is developing resistance to the drug from bacteria that may be exposed to the antibiotic within the bird, to the point where you can have microorganisms that become resistant and more difficult to treat if they are causing a problem. So that's why if there is a condition that may be related to a bacterial infection, that a culture and sensitivity is obtained, so you can identify the bacteria and treat it specifically with what and that's the pathogenic bacteria that's causing the problem, and you can treat it specifically with the antibiotic that it's sensitive to, and that you're not just treating something that, well, I hope it works, I think it's going to work, and then the bird gets worse, and then the next thing you know, a week or two out, and the bird is not doing well, and it's worse, and then you do a culture and sensitivity that takes 3 days to come back, and you see that the drug that you were treating it with is not any good, and so that's what we're, there's no specific amount of antibiotic therapy, but if it just depends on if you have to treat something multiple times with the same clinical disease condition, multiple times with antibiotics, then it has to, there should be maybe more in-depth diagnostics to figure out what's wrong and why the bird isn't responding to that therapy. Or it may be responding, but it may be responding intermittently. It may get better, get it off antibiotics, therapy, and then it comes back.
Yeah.
Well, obviously the antibiotics helped, but it didn't resolve the issue, the underlying issue. And I'm back,
Yeah.
and it's like, oh Lord. And so that's frustrating, not only for the owner, much less the bird, but the veterinarian, because you bring it to us to get it resolved, and if it isn't resolved, that's something that is frustrating. So yeah, that's a good question on that. But the antibiotic use, it should be specific for a specific amount of time, and again, treating a very targeted clinical condition that is, again, caused by a bacterial infection.
Okay. And so now on to the part about the tongue wagging. This is a grain cheek conure. It can cause that, and also seems to that was along with breathing hard.
Yeah. One thing to always consider, with the green cheek, in in birds when they do that. You know, this and you said the environment, all of this, it wasn't you know, warm or hot where it would be we'd be doing that. And then there's no other clinical disease signs that you notice: eating well, good body condition, you know, otherwise. And this goes through. Then what you look at, and again, on birds, on situations like this, if there is something that is abnormal, then you know, and I always say this, when you do a physical exam on a bird, you can look on the outside. That's all. It's, you know, you look on the outside of the bird, and you can see everything. And we've talked about this again, but it's a good thing to always bring up, is that, you know, many times you can look at an animal. I've seen African grays that you look at it, look fine. I take I submit a complete blood count. I do a plasma biochemistry panel to look at what's going on inside the bird. And it may look perfectly good on the outside, but the blood that we get is the results will show a whole different story. And so this is something that that you can kind of combine your observation that otherwise the bird looks good, but it has this behavior that's somewhat unusual. Now we can just go say, "Wait, look, that's just a behavior issue. It's anxiety. You know, no worries." You know, that's the easy way out for me. You know, oh, it's a behavior issue. It's a little anxiety. You know, it was cool in the house and it looks good. It's eating well and everything like that. But if something's abnormal like that, I like to kind of back that up with blood work, so I know what's going on inside of the animal. Now, if everything on the complete blood count and the serum biochemistry panel come back normal, you know, then, you know, there's at that point there's very little, there's no reason to do you know, in my estimation, a radiograph or x-ray or something like that, or any, you know, any other diagnostic test, unless there's something that's pointing to something like that, that would require, say, oh, well, we need to do this test. But otherwise, if the blood work comes back within normal range and there's no other clinical signs, well, then until there's something else different, I would attribute it to behavior. Okay. And whether it gets, you know, has anxiety, or it gets excited or something like that, or it's something that it does because it gets your attention. That's what I would say, until and keep monitoring the bird to see if there's any other disease conditions. You know, for me, and I hear, well, people, well, you know, birds just don't show signs until they're sick or about to die, and you know, really ill and about to die. And I say that's wrong. I say, because I have really good owners that watch the birds, and if you've been around birds, you can say, I know a sick bird just about the time it becomes sick. Okay. I mean, if you know your birds and you watch your birds, if you don't know what to look for, and if you're not aware of birds and you only watch your bird and as you go into the house and go out of the house every day, yeah, until it's like on its last leg, you won't notice anything because the feathers are going to cover all the body. But it's behavior, it's normal behavior, and it's eating habits and things of this nature. So astute bird owners can recognize disease early on. And also not only recognize disease early on, but they can say, hey, doc, this bird, it's a lot better. It's about 95, 98%. They know exactly what this bird and how this bird should act. And so, people say that, but that's not true as far as birds showing signs of disease. That's how other birds know birds are sick and say, we want to make sure you're out of our little flock here.
Yeah.
And that's when they know it early, okay? When a bird can't defend itself, not acting right. And that's when the pecking order comes in. And that's when they abuse the birds that can't defend themselves. So keeping that in mind, I believe, most of the time when birds get ill, they usually show more than one clinical sign of disease. It's not just one. You'll notice if they are ill, they'll usually be depressed, a little lethargic. They're not going to be as active as they normally are. They may not perch in the same places they do. They may not eat like they do normally, or their normal eating habits. And then they may have other disease conditions such as diarrhea. You may notice nasal discharge. Nasal discharge, it doesn't mean that they have active runny nose, that the nose is just flowing, nasal discharge, but you may notice matting around the feathers, around the nares, and that's one way to tell. But so with this little bird, if it hasn't had a CBC, and again, say a green cheek conure at 60 grams, so you have to, may bring it in one time for a 60, 70 grams. You bring it in one time for a CBC, and then have to wait a few weeks and bring it in for the chemistry panel. And then you'll have the information, the veterinarian will have the information to say, hey, don't see anything, or, oh, look at this, this may be what's a problem. So there you go.
Okay. Now we got a question from Frank, who wants to know if, in your experience, is there any evidence that the process to create pellets leads to carcinogens, or that ground corn or soybean meal in pellets is harmful, as apparently it's been claimed on an online parrot nutrition website. So what's your take on pellets and
that's a good question. That's a good question. Because at this time, I'm not aware of any pellets causing or being linked to, what was it, like cancer or something like that?
I didn't see carcinogen.
Carcinogen, yeah.
Sorry, did I say carcinogen?
Yeah, so,
sorry.
yeah, linked to cancer development in birds. There's nothing that I'm aware of that links that. So anything would be speculative at this point, just no different than you say it leads to autism in parrots. There's nothing that would say one way or the other. And for the most part, and we just submitted a manuscript to a journal on a case study of five cases of stomach cancer in birds, proventricular cancer in birds, and also what you're looking at here is that I think the benefits, if you have the benefits of a formulated diet, most of the formulated diets are extruded diets, and also with parrots, they chew it not maybe in the true terminology of mastication, because you don't have a lot of mucus within the parrot beak, but they will grind the pellets down into a smaller diameter, and or grind them down in before they ingest them, and then the mucus within the crop is going to soften that. So by the time that the pellets get into the stomach, they're going to be very much a slurry of meal for the most part. But and so I don't really see where the process is going to increase the chance of the cancer in significantly in any sense whatsoever. I think that anything that we have as it relates to stomach cancer in parrots is through the longer lives that we're providing to these birds. So they're living longer. Okay, so the longer that they live, some of the geriatric conditions that you have with any animal is cancer. And so I think that if you're going to look at something as a direct link to any cancer development within birds, and particularly stomach cancer, it's going to be more along the lines of having the birds live longer lives in captivity through better care, better nutrition, and better health care of the animals.
That's a good point. All right, hopefully that was an excellent point, actually. So Gloria had a question on how to syringe meloxicam. Meloxicam, is that right? Is that pronounced that right? Meloxicam without aspirating the bird. And what she wants to know, is there a preferred left or right side of the beak to administer the med into? I'm sure you've got a take on that.
Oh, it's Gloria, right? Thank you, Gloria. That's yeah. All of the questions have been fantastic. It's just like I'm going like, oh my goodness, I have difficulty treating birds. Which side of the beak that works, the side that works the best, and that is an excellent question. And really, I don't have a preferred side of the beak to use. Whatever is most comfortable for you to access is what I would say is the best way to provide the oral medication, whether it's meloxicam or if you've been prescribed some other type of oral medication, which is probably and arguably the most common form of medication that we prescribe for birds, simply because who wants to get injections? That's my theory. I don't want to give injections to the bird because I don't want injections, but if we have to, we have to. But nonetheless, either side would work. But there's a couple of things with birds. One, as far as getting it in, I would say if you could get the syringe at the very corner of the beak and get the medication in to the side of the beak, then that would be the best, to get it into the side, going toward the side as opposed to down straight. Because if you look at the bird's tongue, And so you look at the bird's tongue, what you see on the tongue, if you see this right here, this is the tip of the tongue. Right at the base of the tongue is the glottis. This goes down into the trachea. Okay, so it's right at the base of the tongue. So really what you want to do is go into the side of the beak if you can, and slowly give the medication. And if it's a drop, then it's easy. If it's more and it's a bigger bird, then what most of it'll do is go under the tongue into the mandible. Okay, and the bird would be able to swallow it. But as soon as you give the medication, is set the bird down, because if you set the bird down, the bird will relax and concentrate on swallowing and ingesting the medication. If you keep the bird in your hands right after you give it, then it's struggling and trying to get out, and then it can aspirate that way. So it's on the side of the beak, and with the head up, and then that will actually allow it to go down under the tongue on that, and then the bird can swallow it that way. That's any time that you give, if you have to give any if you're giving supplementation to the bird, say emerate or something of that nature, and you're supplementing, or you're doing a kind of a gavage, you're getting it into the crop, you always want to make sure that as soon as you're finished, that you set the bird down. You don't want to hold the bird, because it'll struggle, and then that's when it can aspirate. So hopefully that's somewhat helpful.
And if you are gavage, there's an angle, you don't want to go one side, or is it the sorry, I don't hand feed birds. When you're, for example, syringe feeding a bird, you avoid you want to angle the delivery method towards the crop, so it goes proper.
And so you can go, and I go, again, I will feel and just for a smooth, you can say left side, but I'll feel and just make sure if the gavage needle is going down, or the tube is going down, that there's no resistance. I'm not in any time that there's any resistance. And for the most part, if you're holding the bird, you can feel that go down the esophagus into the crop area. But that would be done with some training. You would need to make sure that you have somebody show you how to do that, and so you wouldn't actually perforate the esophagus or the crop.
Okay. And I just wanted to real quick circle back to the point that you say that to put the bird down after, so it has time to swallow and stuff.
Yeah.
So say if you have to towel your bird to administer medicine, I know that commonly people, when they towel the bird, they kind of tilt them on their back a little bit. Is that something that you wouldn't want to do, is have it tilt, like, where it's leaning backwards in your hand? If you're,
well, I would say like a 45-degree angle.
Okay.
On that, I would say a 45-degree angle is what we would normally use with that in administering oral medication to the bird.
I imagine it'd be similar to trying to drink a glass of water, like laying flat. It would be very hard on your.
Yes, yeah, very much so. Very much so. Yeah.
All right. So then we have a question from Tammy about her 15-year-old Quaker parrot. who has been diagnosed with arthritis in his feet. The diagnosis came from an X-ray, and he was given Medicam for the pain. What can I give him to prevent the arthritis from becoming worse? And he doesn't fly. And I used to target train as an exercise, but now his feet hurt. So what type of exercise would not cause him pain now?
Well, so this is a 15-year-old Quaker, right? And has been diagnosed with kind of an osteoarthritis of the feet, correct?
Yep.
And so her questions are, what exercise would not contribute to this getting worse? And is there anything she can do to?
Yeah, and she want to know what she can give him to prevent the arthritis from getting worse. So.
Yeah. Well, you know, I don't know if there have been some formulations. Rowdy Bush, I don't know if they have what their prescription diets are, but if it has anything within the and as far as how well they work, I can't say how well any supplementation works for osteoarthritis. No different than if I take osteobiflex to prevent any keep my joints all good. I don't know how well that works. Is it psychological or is it real? And so I don't think that there's anything that that's out there that is proven to be helpful. And then, like I said, I know that the Rowdy Bush did have some prescription diets, and I don't know if they went into the kind of the osteoarthritis, and I'm not aware of any supplementation that that can help reduce the effect of this, or maybe improve the condition in older birds. So but I keep my eyes open for this, and this is a good question all the time. And just for what you say, the birds, and what I've said, birds are living longer and they're getting older, and this is one of the conditions that you have, and you would like the birds to be healthy enough where you wouldn't have to prescribe meloxicam forever.
Yeah.
And so the main thing, I guess, I'm not aware of any supplements. There may be that are proven. I'm sure that you can go online and find some supplements that somebody's willing to sell you, but I don't. There's no evidence that that they actually work. Okay, and I'll tell you that because we would know about it. But if you want to try that, then that's don't expect anything. There's no guarantees for it, at all. But that may be something, and I don't have anything there. But as far as the any exercise out there that I would always what I would do is, if it's having difficulty getting around, is just to make sure that its enclosure that they can get access to the food, the water, and its favorite perch or what have you easy. And I mean, we've had birds that have had one leg, that we've had to amputate or what have you, or been splay leg that we've helped get to a point where they have a good quality of life. And they have to have accommodations within the cage that they can get to. And so this is something that you can do, because that will help it get around with minimal pain and difficulty.
Yeah, and just going back to diets, I know people have some with the Lafeber senior nutriberries. That's one diet that's targeted for senior birds, so it's got the extra nutrients for that.
Yeah, there you go. Yeah.
Arthritis. Let's see. A question from Dorothy. 1-year-old female budgie recently developed a small brown hypertrophy, sorry, not trophy, on her sear about 2 months ago. And when she was taken in for her nail trim, the vet said that she recommended a once a week dab of coconut oil on the sear. So Dorothy has been doing this, and it looks about the same, and it's not interfering with her nostrils. What happens next? Because I know she's saying, what happens next? Because I know if it's removed or she knocks the small growth off, will it just grow back? And she'll be taking her in for her official annual checkup this summer. So what to do about a growth on the sear.
Yeah.
And good for you, Dorothy, on taking your bird in for the annual checkup. So I want to point that out.
Yeah. And so this is a, how old of a budgie is this? 1 year?
1-year-old, so relatively young.
Yeah. Yeah. Well, yeah, we'll see. Yeah. And again, you're sure your veterinarian looks, well, we can get, this growth, this hypertrophy of the around the sear or the beak, with scaly face mites, and it doesn't, and I'm sure your vet would have looked at that, and it isn't. I just wanted to mention that you can have some abnormal beak growth and some hypertrophy just due to those in budgies, and I think that many budgies may have this, but they are exposed to it, but they don't have the clinical signs just out of their immune system. But nonetheless, this does occur. Some of these birds can get as they mature, and they sexually mature. The sear can get a little bit enlarged, and so with that, so it's kind of hormonal. It can be hormonal. That's what you'll see in the literature, and that it's not necessarily a problematic disease condition, and it doesn't take much on a little budgie to make it look really enlarged. And so with that being caused by hormonal and through the tissue growth there, and enlargement, it's unlikely that the coconut oil is going to reduce that. But at the same time, it probably makes it soft, but it's not likely to reduce that. And since it's individual, most of the time, let's just say we have, it's not across all color mutations of budgies, but it can be close. But for at least the wild budgies, in my experience, if they're blue sear, it's a male, and if it's a brown or kind of a pinkish sear, it's a female. And in some of the sometimes you can have sear changes if there's a neoplasia, cancer of the ovary or testicle, and so you can have changes there. I'm not saying that that's what this is by any stretch, but I know that we've had budgies with tumors, just like humans have babies with tumors, but it's more rare. And but I would say that this possibly is a variation of a normal sexual maturity in this female budgie, and that it'll just be a little bit enlarged, and that'll just be it's normal.
Okay. If I'm remembering correctly from my bird talk days, and I could be totally wrong, but during breeding season, does the female seer kind of get a little like crusty-ish?
It can, yeah. Yeah. And again, they can change color. I mean, the female from a pink to a brown, and again, I think it's again attributed to the hormonal effect on that.
Okay. Well, we are out of time on our questions today.
Already?
I know it flew by, excuse the pun, but yeah, it flew by.
Yeah, no pun intended, Laura.
No pun intended, sorry. So I'm gonna a couple updates on our webinars that are coming up in July. I'll do that first, and then I'll stay tuned because I have the announcer. I gotta announce the winner of our giveaway. So So unfortunately we had to postpone our webinar that was scheduled for next Friday with Lisa Bono. So Lisa, her gray Abby just had a wing mass biopsy, then she's waiting for the results. So we're going to give her a little space because that's probably a very stressful time. So that one, let's see. So we're going to have a little break here, but we're going to return July 16th with Dr. Lamb, and she's going to present her second episode of the Avian Vet Insider. And this time around, she's going to go over the routine avian exam. So, and then on July 23rd, we're going to have you on again, Dr. Tully, with some more Q&As. So,
all right.
So yes, and then on July 30th, at the end of the month, we're going to have Dr. Susan Arose with. She's going to present on avian coronavirus, which is an important talk that that bird owners should be aware of. Correct? Because you concur. Coronavirus. So anyways, so that's what we have coming up ahead. We have a little bit of a break, so if you want to go on vacation, this is time to do it, everybody. And we'll see you in July 16th is when we'll be back on live. And then real quick, today's winner of our product giveaway, which is the tropical fruit pellets, as well as another bag of Lafeber food of your bird's choice, is going out to Marilee M. So Marilee M, someone from the Lafeber office will reach out to you next week to send it off. So on that note, we got some thank you, Dr. Tully and Lafeber team. So thank you for joining us.
Well, thank you, Laura, and thank Brenda and Lafeber for having those webinars and the wonderful attendees. I mean, and questions. I mean, from all over. It's fantastic. Great questions, and I just love it. And hopefully we'll see you in July and get the questions that we didn't get to today, and try to learn more about these wonderful animals that we just love to have, and I just like to get better, and so they can live long, happy, healthy lives. So thank you.
That's very true, because you're giving up your time for all this. So you definitely have it. You have it out for the birds as far as what's best for them. So totally appreciate that, Dr. Tully. Yeah. On that note, I'm going to wish everybody a very happy weekend. All the best to you and your flock. Stay safe and come back in July. Tune in, and we'll see you again in July too, Dr. Tully. So thank you guys.
All right. Thank y'all. Bye.
Bye.